Actually, right, if you think about it, if
Yeah.
you're doing medicine, right, how do you know what are the after effects of that specific medication if everybody comes in as a different patient? You know what I mean? Like if I came in, you wouldn't know what my allergies are. You wouldn't know what my reactions are if I ate a specific medication, right? So how do you recommend something and like be sure that this guy won't have, I don't know, a heart attack or like won't have a seizure or whatever? You know what I mean?
So for medicines, essentially this is going to the pharmaceutical industry.
Uh-huh.
There's proper clinical trials, phase
Yeah.
1, phase 2, phase 3 clinical trials, and then they will test to see, what's the side effects, what's the effect, whether the drug is efficacious, means whether it's, useful,
Yeah.
treating a certain condition, what are the side effects. Some side effects turn out to be,
Oh, that's why the bottle has a label that says like, oh, this may cause
cause this and this. What they say in a certain population of people, it does cause this. Yeah, so you always watch it. But I think for side effects wise, as in allergic effect to medication, it's really something that the doctor will just tell you, okay, we know that this medication tends to have some side effects, some like allergies or things. Then to take it and monitor it. Let me know if there's any issues, and then come back. Yeah, so. We know some medications like cholesterol lowering medications that's cause some muscle aches sometimes.
Whoa.
Yeah, and it's a known side effect. But it can get a bit worse lah. And so that's why usually we'll tell patients, okay, if you're starting this medication, let me know if you have any muscle aches. And we review them and
I see.
titrate the medications from there. Like maybe don't increase it too high.
The
bring it down
dosage
a little
wise.
bit. Yeah, bring it down a little bit where there's a level that still works.
Yeah.
But maybe we take a little bit longer to control your cholesterol by medication. But the most important thing is of course all that dietary stuff.
Yeah.
It's very hard for me to say I'm slightly chunky, but
But I think it's tough, man, right?
Yeah,
Yeah.
it's tough.
You were saying something?
No, like my dad, right?
yeah.
Post-COVID, he had blood clot in his lungs.
Holy shit, what?
So when he had blood clot in his lungs, he had to take the Apizaban pills.
Yep.
This sort of help disintegrate the blood clot, is it? Yeah. So like when that happens, it gives him shingle.
What?
Yeah. Bro, there was one day I was watching TV. He just came in front of me and he pulled down his pants. Then he was showing me, can you see like red stuff on my ass? I'm like, yeah, I can. It's disgusting. But then he's like, is this normal? So like, I also got scared lah, right? Because I think maybe the pharmacist told us that this could happen, but I didn't know what shingles was really like.
It's like the level 2 of chickenpox, bro.
Is it?
Yeah.
Yeah.
So like I got worried lah. That's all.
Yeah.
But then after that I called and then they say it's okay lah. It's gonna be back to normal again after like a couple of months lah. But
Is this
yeah.
recent?
Yeah, it was quite recent.
Bro,
It was like
we haven't gone to the park enough. Bro.
February, bro. No, I think I told you guys.
No, man. I didn't hear this shit. I would remember this because I would have told you shingles is like level 2 chickenpox, bro.
Oh yeah.
And it's painful,
Yeah,
shingles.
yeah, it's painful.
Shingles is painful.
It's not like, chickenpox is itchy. Actually, it didn't really itch for me, but different people different. But I know shingles, it hurts, right? It hits the nerves and shit.
Yeah, and then like he don't sit down normally, like how he's sitting. He just lays in his
Oh
front.
my lord.
Because it's quite pain lah. Yeah.
Yeah.
But after that, I think after a few months he was okay already.
I mean, definitely. So knowing post-COVID, so COVID we know causes hypocoagulable state. Essentially, there's
Hyper what?
hypercoagulable. Essentially,
Oh,
you have
your
a
blood.
state where your blood can clot lah. There's high risk of clotting lah. So this lung clot thing is very unfortunate lah. But luckily, he's taking apixaban. Essentially, is a blood thinner. It's a new novel kind of more
Kind of
advanced
like
version.
paracetamol, right? Paracetamol also thins blood, right? No, man?
There is a side effect of it. There's a small effect of it, but essentially, like the one that everyone knows, like warfarin, is the
Warfarin.
Warfarin essentially is the blood thinning medication lah. But instead of apixaban, it's the more it's a different mechanism,
Intense,
but
eh?
more fancy. Yeah. So shingles unfortunately happens when you have chickenpox, or you
I
got
see.
the chickenpox vaccination when you're younger, less likely, definitely less likely.
Yes.
But for chickenpox as a child, then the virus actually stays in the,
Yes.
in the nerve roots lah.
Okay.
It can come out when you're older.
I mean, since we're in the topic of pox, right?
Oh, we're gonna ask about monkeypox, bro. Holy